It happens faster than you can process. One moment, two dogs are sniffing tails, wagging in friendly curiosity at the park. The next, a low growl rumbles, a lip curls in a blur of fur and teeth. The encounter explodes into a fight, a blurry, violent burst. The air fills with snarling and yelps. Your heart hammers against your ribs and a surge of adrenaline floods your system. Your first instinct might be to scream, to rush in to grab a collar. But what you do in these critical first seconds can drastically alter the outcome for everyone involved, including you. It's a terrifying moment, yet being prepared can make all the difference. Understanding what to do and what not to do. To prevent a fire, you must first understand what causes it to ignite. The same is true for dogfights. These altercations rarely happen for no reason. They are often the result of a series of miscommunications, environmental pressures, underlying behavioral issues. One of the most common triggers is resource guarding. Food, a favorite toy, a comfortable resting spot, or even their owner. If another dog approaches that prized resource, the guarding dog may use aggression, from a warning growl to a full-blown attack. "This is mine. Stay away." This behavior is instinctual and not a sign of a bad dog. Fear is another powerful motivator for aggression. A dog that feels cornered, threatened, or overwhelmed may bite as a form of self-defense. Imagine a dog nervous around others. Forced into a crowded park or approached too quickly, its anxiety can escalate. When subtle signals, lip licking, yawning, turning away, are ignored, the dog may feel it has no choice but to use its teeth to create space. Pain or medical issues, arthritis, an ear infection, an injury, lower tolerance for interaction. Even gentle dogs might snap if a sore area is bumped or touched. Sudden aggression should be evaluated by a veterinarian to rule out physical causes before labeling it behavioral. When a fight erupts, your own emotional state is the first thing you must control. It sounds counterintuitive, but your most powerful tool is your own sense of calm. Dogs are incredibly sensitive to human emotions. They can feel your heart rate increase. They hear panic in your voice and see frantic movement. If you run toward them screaming, you add fuel to the fire. Take one deliberate breath. Be effective, not emotionless. Arrive calm. Assess. Act with purpose. Don't grab collars. Don't put your body between fighting dogs. Avoid hard eye contact. Move deliberately. No sudden jerks. Be large and commanding, not threatening. You're there to break up conflict, not punish. Your stability is the anchor. It may not stop the fight instantly, but it makes safe intervention far more likely. Remember, your calm is your anchor, the first and most critical step to control the chaos. When it is time to physically intervene, your safety and the safety of others is the absolute top priority. Never reach toward the dog's heads or grab their collars. In high arousal, a dog will bite whatever is closest. Use tools and techniques that keep your body at a distance. With two people, the wheelbarrow technique is highly effective. Each person approaches from behind and grabs their dog's back legs, lifting them off the ground. Walk backward to pull them apart, then turn in an arc so they cannot see each other. This disrupts balance and leverage, forcing release without hands near mouths. Alone? Use environmental tools to create a barrier. A large piece of cardboard, a trash can lid, a folded lawn chair, even a baby gate. Use steadily like a moving wall, never to strike. Sudden loud noise, clapping, banging pots, a car horn, an air horn can create a brief pause to secure a dog. Water works if a strong nozzle is nearby. A small squirt bottle likely won't. A brake stick is effective but requires training. A leash can loop the hindquarters to pull a dog back at a safe distance. Once the dogs are physically separated, the crisis is not over. Prevent re-engagement, immediate priority. Adrenaline is high. If they can see or hear each other, the fight can reignite instantly. Securely leash both dogs. Each owner takes control of one dog and creates distance. Move them apart until they're out of sight. Place them in secure, separate areas, different rooms, opposite sides of a house, or separate cars. Keep calm with the other owner. Don't blame. Focus on well-being. Exchange names and phone numbers. Verify and photograph vaccination records, especially rabies. Calmly inspect your dog. Scan visually, then run hands to find swelling, tender spots, or hidden blood moisture. Check neck, legs, chest, and stomach. Punctures can be deep and infected. Check the mouth for cuts or broken teeth. Photograph injuries and the location. Useful for your vet, animal control, and insurance. First aid may be necessary to stabilize before the vet. It's not a substitute, just to prevent further harm. Control active bleeding with firm, direct pressure. Clean cloth, sterile gauze, or a t-shirt if needed. Hold for 3 to 5 minutes. Don't repeatedly check or you'll disrupt clotting. If needed on a limb, add pressure to the artery, front leg, armpit, rear leg, groin. Tourniquet only as last resort for life-threatening bleeding. Keep it wide. Loosen 20 seconds every 15-20 minutes. For superficial scrapes or small punctures not bleeding heavily, gently flush with sterile saline. If not available, use clean lukewarm water. Avoid hydrogen peroxide, rubbing alcohol, and harsh antiseptics inside the wound. They can be used around the fur, not in the wound. Don't apply ointments or close wounds unless it's a very minor scrape. Punctures are deeper than they look. Get to a veterinary clinic as quickly and safely as possible. No matter how minor injuries appear, a vet visit after any skin-breaking fight is essential. The visible bite is often just the tip of the iceberg. Canine teeth puncture deep. Small holes can mask torn muscle, bruised tissue, severed nerves. Bacteria are injected deep, setting the stage for serious infection and abscess. Vets shave around wounds to reveal hidden punctures and lacerations. They flush thoroughly with antiseptic to remove bacteria and debris. Deeper wounds may need exploration, debridement of dead tissue, and temporary drains to prevent abscesses. Almost all bite wounds are contaminated. Antibiotics are standard. Pain control reduces stress, speeds healing, and prevents negative behavioral change. The visit creates an official record, vital for animal control, legal, or financial issues. Do not skip this step. The cost is small compared to safeguarding your dog's health and preventing emergencies later. The injuries from a dog fight are not always physical. Psychological trauma can last after the body heals. Shock is life-threatening. Watch for pale gums, a rapid but weak pulse, rapid shallow breathing, cold ears and paws, weakness or daze. Go to the vet immediately. Keep them warm. Expect emotional fallout. Withdrawal, hiding, loss of appetite or thirst, trembling, hypervigilance. Previously social dogs may lunge, bark, or growl on walks. They may seek reassurance or guard a sore spot. Be patient. Avoid forcing situations. Offer a safe, quiet resting area. If signs persist or worsen, seek help from a certified trainer or veterinary behaviorist using positive reinforcement. The best way to handle a dog fight is to prevent it from ever happening. Prevention starts with education and management. Recognize stress, tucked tail, whale eye, lip licking, excessive yawning, tense posture, then remove your dog early. Socialize through brief, positive, trainer-led or calm meetups. Quality beats quantity. Build reliable cues. Come, leave it, stay. Using positive reinforcement to keep focus on you. Manage triggers. Skip on leash greetings. Separate around toys and food. Pick calm routes and play areas. If fear or reactivity appears, get professional guidance. Be vigilant, educated, proactive, and make your dog's world safer and calmer.